Lesson 1. What is depression? Depression is one of the most common and most burdensome health conditions in the world today. It affects millions of people regardless of age, education, or social status. Despite this, it is still often mistaken for sadness, a weakness of character, or a lack of motivation. This way of thinking not only fails to help, but often deepens the problem because it shifts responsibility away from biology and onto moral self-judgment. In this lesson, we will not focus on thoughts, emotions, or psychological interpretations. We will begin with the foundations. Depression will be presented here as a state of biological overload of the organism, with measurable genetic, physiological, and population-level determinants. Before attempting to change anything, it is worth first understanding what actually happens to the body and the nervous system when depression emerges. This approach has one essential goal: to remove the label of personal failure from depression. If you understand that what you are experiencing is a predictable reaction of a sensitive biological system to prolonged strain, it will be easier to move on to the next stages of this book. First, however, let us look at the facts, the scale of the phenomenon, genetic vulnerability, and the biological mechanisms that underlie depression. 1. Depression as a population-level phenomenon. Depression is neither rare nor marginal. From a public health perspective, it is one of the most common and most burdensome health conditions in the modern world. It is estimated that at any given moment, clinical levels of depressive symptoms are present in approximately 4 to 6% of the adult population, while 15 to 20% of people will experience a depressive episode at some point in their lives. This means that depression is not an exception, but an experience that affects a substantial part of society. It is worth noting that although anxiety disorders are statistically more common, depression generates greater functional costs. It is one of the leading causes of long-term inability to work, occupational absenteeism, and reduced quality of life. On a global scale, depression ranks among the top conditions responsible for so-called years lived with disability, surpassing many somatic illnesses that are commonly considered more serious. Epidemiological data also show that depression is not limited to any particular social group. It occurs in both younger and older individuals, among those who are professionally active and those who are unemployed, among people living in prosperity and those functioning under conditions of chronic deprivation. This means it cannot be reduced to life problems, a lack of resourcefulness, or a specific personality style. From a biological and statistical perspective, depression therefore appears as a common human response to certain conditions of overload, rather than as a peculiar anomaly or evidence of individual weakness. The scale of its occurrence is the first signal that at the core of depression there must be a universal mechanism, related to the functioning of the nervous system itself, and not solely to a person's life history or way of thinking. 2. Genetic vulnerability, the biological background of depression. When we speak of genetic vulnerability to depression, we are not referring to an abstract psychological tendency, but to specific biological properties of the nervous system. Family and twin studies indicate that genetic factors account for approximately 30 to 40% of the risk of depression. Genes, however, do not encode depression itself. They encode the way the brain and the body's neurochemistry function. The most important area of this vulnerability lies in the regulation of neurotransmitters, the chemical substances responsible for communication between neurons. In depression, the key roles are played primarily by serotonin, dopamine, and noradrenaline. These systems regulate mood, energy levels, motivation, the ability to experience pleasure, and the response to stress. Genetic differences concern, among other things, the number of receptors, the speed of neurotransmitter reuptake, and their sensitivity to stress-related stimuli. In individuals with greater biological vulnerability, the nervous system becomes dysregulated more easily. Under conditions of chronic stress, serotonin levels drop more rapidly, leading to low mood and sleep disturbances. Dopamine, responsible for drive and the reward system, ceases to function effectively, causing a loss of meaning, motivation, and the capacity to feel satisfaction. Noradrenaline, which regulates alertness and responses to challenge, remains elevated, keeping the body in a state of tension and exhaustion. The same biological mechanisms are also present in other severe mental disorders. Schizophrenia, bipolar disorder, and severe anxiety disorders are likewise based on genetically conditioned sensitivity of neurotransmitter systems and their dysregulation under stress. The difference between these conditions does not lie in some being are biological and others psychological, but in which neurochemical systems decompensate and in what way. Socially, schizophrenia is perceived as a severe and dangerous illness requiring immediate intervention, while depression is often minimized. From a biological point of view, however, depression is not a milder disorder, but a different form of breakdown of the same system. Moreover, depression is associated with the highest risk of suicide among all mental disorders. The vast majority of suicide attempts and completed suicides are linked to depressive episodes, often long ignored or misinterpreted as a psychological crisis or a temporary low. In this sense, genetic vulnerability does not mean being condemned to illness, but defines the biological limits of the nervous system's resilience. When prolonged stress exceeds these limits, the neurochemical system loses its capacity for self-regulation. Depression is then not a problem of character or thinking, but a neurobiological state that calls for understanding and an appropriate approach. 3. Chronic stress as the trigger of depression. Genetic vulnerability alone does not cause depression. It is a precondition, but in the vast majority of cases the triggering mechanism is chronic stress. What matters is not how stress is subjectively evaluated, but how long and how intensely it acts on the organism. From a biological perspective, stress activates the so-called HPA axis, hypothalamic pituitary adrenal axis. This is the body's alarm system, designed to mobilize energy in situations of threat. In the short term, this mechanism is adaptive. It increases cortisol levels, heightens alertness, suppresses regenerative processes, and redirects resources toward survival. The problem begins when this mode is not switched off. Under conditions of chronic stress, the HPA axis remains active for weeks, months, and sometimes years. Cortisol ceases to serve a protective function and begins to act destructively. Circadian rhythms become disrupted, deep sleep is weakened, and repair processes within the nervous system are inhibited. The organism functions in a state of constant mobilization, which gradually leads to depletion of neurobiological resources. Cortisol is one of the key hormones regulating the body's energy economy. Its primary function is not to cause disease, but to ensure survival in situations of threat. Under the influence of cortisol, the body increases the availability of glucose in the bloodstream, mobilizes energy reserves, limits regenerative processes, and suppresses functions deemed non-urgent, such as digestion, immunity, and reproduction. In the short term, this mechanism is adaptive and effective. The problem arises when elevated cortisol levels persist chronically, leading to systemic dysregulation of metabolism and physiology. Prolonged elevation of cortisol disrupts the functioning of the entire organism, not only the brain. It contributes to insulin resistance, fluctuations in blood glucose levels, and chronic fatigue despite apparent activation. It weakens the immune system, increasing susceptibility to infections and inflammatory states, while simultaneously disturbing sleep by inhibiting phases of deep regeneration. At the level of the nervous system, cortisol accelerates the breakdown of synaptic connections, limits neurogenesis in the hippocampus, and disrupts the balance of neurotransmitters. As a result, the organism remains in a state of continuous mobilization without a real possibility of restoring its resources, which biologically paves the way toward a depressive state. Persistently elevated cortisol levels directly affect neurotransmitter systems. They inhibit the synthesis and release of serotonin, disrupt dopaminergic transmission, and destabilize noradrenergic balance. As a result, the brain loses its capacity to precisely regulate mood, energy, and responses to stimuli. This is not a sudden process, it is a gradual dysregulation of the system, often unnoticed in its early stages. A particularly stress-sensitive brain structure is the hippocampus, responsible for memory, temporal orientation, and inhibition of the stress response. Cortisol acts neurotoxically on the hippocampus, reducing its plasticity and regenerative capacity. In practice, this means that the organism loses its ability to dampen stress, entering a vicious cycle. The longer the tension lasts, the harder it becomes to calm it. It is precisely at this point that the transition from an adaptive stress response to a depressive state occurs. The nervous system does not break down, but rather fails to keep up with regulation. From a biological perspective, depression is therefore a state in which the stress system remains active for too long, while the systems responsible for regeneration, drive, and the experience of meaning become functionally shut down. It is also important to note that chronic stress does not have to take the form of a single dramatic event. Much more often, it consists of long-lasting, seemingly ordinary burdens, constant pressure, lack of a sense of safety, chronic responsibility without the possibility of recovery, as well as prolonged loneliness. From a biological standpoint, the nervous system does not distinguish between psychological and physical stress, it responds to the duration and intensity of the load. In this way, chronic stress becomes the key factor that exceeds the biological tolerance limits of a vulnerable nervous system. Depression then does not appear as a sudden collapse, as in schizophrenia, but as the logical outcome of prolonged overload that has not been adequately discharged or regulated. For overload of the nervous system, what happens to the body? When chronic stress and persistently elevated cortisol levels continue over an extended period, the nervous system gradually loses its ability to self-regulate. There is no sudden breakdown. Instead, the organism slowly shifts into a resource conservation mode. The body begins to function as if the threat were permanent and regeneration had to be postponed indefinitely. One of the first areas to become disrupted is sleep. The phase of deep sleep, responsible for restoring the nervous system, becomes shortened, and sleep turns shallow, fragmented, or shifted within the circadian rhythm. The organism may remain in a state of chronic fatigue despite spending many hours in bed. This is not a matter of poor sleep hygiene, but a biological consequence of continuous activation of the stress system. At the same time, a decline in energy and vital drive appears. This does not stem from laziness or a lack of motivation, but from a reduction in available metabolic resources. Operating in a protective mode, the nervous system reduces energy expenditure on everything that is not essential for survival. This leads to the characteristic feeling of having no strength for life, which is one of the most typical symptoms of depression. Cognitive functions are also affected by overload. Concentration, working memory, and decision-making ability deteriorate. This is a direct result of dysfunction in the prefrontal cortex and the hippocampus, structures that are particularly sensitive to the effects of cortisol. In a state of overload, the brain stops functioning flexibly and shifts into a reactive mode, focused on survival rather than planning or creativity. At the somatic level, nervous system overload also manifests through immune disturbances, muscle tension, digestive problems, and chronic pain. The immune system becomes weakened, while at the same time the level of low-grade inflammation increases, further affecting brain function. The body and the nervous system do not operate separately here. They are part of a single, mutually reinforcing process. In this state, the organism increasingly functions on reserve. Each subsequent stressor, even a minor one, triggers a disproportionately strong reaction because the system no longer has a safety buffer. It is at this stage that depression becomes clinically visible, not as a sudden psychological collapse, but as the cumulative effect of long-term biological overload that has encompassed the entire organism. 5. What brain research shows in depression? The development of neuroimaging techniques over recent decades has made it possible to look directly at how the brain functions in a depressive state. The resulting picture is consistent with the earlier description of nervous system overload and does not support the idea of permanent brain damage. In depression, what is primarily observed are functional changes rather than structural ones, an important distinction when considering the reversibility of this condition. One of the most frequently described findings is reduced activity in the prefrontal cortex, particularly in areas responsible for planning, emotional regulation, and decision-making. The prefrontal cortex serves as a kind of management center, and its reduced activity leads to difficulties in initiating actions, decreased cognitive flexibility, and a sense of being stuck. This is not the result of a lack of motivation, but of limited availability of neuronal resources. At the same time, disturbances are observed in the functioning of the limbic system, especially in structures responsible for emotional processing and stress responses. The amygdala may show heightened reactivity, which promotes the persistence of tension and negative affect, while the mechanisms that normally inhibit this response function less effectively. The brain remains in a state of increased vigilance, even in objectively safe situations. Particular attention has been paid to the hippocampus, a structure crucial for memory, temporal orientation, and regulation of the stress axis. In depression, a reduction in hippocampal volume and decreased neurogenesis are often observed, directly linked to prolonged exposure to cortisol. What is important, however, is that these changes are dynamic and reversible. When overload subsides and biological conditions improve, the hippocampus regains its capacity for regeneration. Research also points to a weakening of the reward system, based primarily on dopaminergic transmission. This mechanism is responsible for the characteristic anhedonia of depression, the loss of the ability to experience pleasure and meaning. Stimuli that were previously reinforcing no longer activate the relevant brain areas. Not because nothing brings joy, but because the biological system responsible for experiencing reward is operating below its functional capacity. The overall picture of the brain in depression therefore reveals a system operating in an energy conservation mode and heightened vigilance, with reduced plasticity and adaptive capacity. Crucially, however, these are not permanent or degenerative changes. The depressed brain is not damaged, it is overloaded and functioning under conditions for which it was not designed in the long term. This conclusion is of fundamental importance, since depression is a functional rather than a structural state. The process of recovery does not involve repairing the brain, but restoring the conditions in which the nervous system can regain balance and plasticity. In the next section, we will summarize the biological picture of depression and draw the most important systemic conclusions from it. 6. Types of depression, different forms of the same overload. Although depression has a common biological foundation, it does not always present in the same clinical form. The differences we observe do not arise from distinct diseases, but from how and where the nervous system becomes overloaded, how long this state persists, and which compensatory mechanisms the organism attempts to activate. For this reason, it makes sense to speak of types of depression not as separate entities, but as variants of the same biological process. The most common form is episodic depression, in which symptoms emerge after a period of prolonged stress and persist for weeks or months. Biologically, this form is dominated by dysregulation of the stress axis, sleep disturbances, and reduced activity of the reward system. The organism functions in a state of exhaustion, yet still retains a partial capacity for regeneration. It is precisely this form of depression that is most often minimized, despite the significant risk of symptom progression. Another form is chronic depression, dysthymia, characterized by long-lasting, often multi-year, reductions in energy and vital drive. In this case, the nervous system does not experience an acute collapse, but instead operates persistently below its optimal level. Neurobiologically, this involves a stabilized dysregulation of neurotransmitters and the stress axis, which the organism comes to treat as a new normal. As a result, individuals affected by this state often do not recognize depression as an illness, but rather as a trait of their personality. Atypical depression is also distinguished, in which low mood is accompanied by increased sleepiness, heightened appetite, and emotional hypersensitivity. From a biological perspective, this represents a different adaptation strategy of an overloaded system. Rather than mobilization and tension, the organism adopts a strategy of slowing down and shutting in. Despite the different symptom profile, the underlying mechanism remains the same: regulatory failure of the nervous system under conditions of prolonged load. A particular form is reactive depression, which appears after a strong stressor such as loss, trauma, or a sudden life change. Although its onset is easy to associate with a specific event, the biological mechanism does not fundamentally differ from other forms. What determines the development of depression is not the event itself, but the duration and intensity of the stress response and the organism's capacity to return to equilibrium. It is also worth mentioning seasonal depression, in which disturbances of circadian rhythm and light exposure play a significant role. Here, nervous system overload results from dysregulation of the biological clock mechanisms, which secondarily affects neurochemistry and hormonal balance. This is yet another example of how different factors can lead to the same final state, depression as biological exhaustion of the system. Regardless of clinical form, the most important common denominator of all types of depression is overload and loss of the nervous system's capacity for self-regulation. Differences in symptom presentation do not change the fact that we are dealing with the same biological process, requiring similar therapeutic frameworks. This distinction will be of key importance in the later parts of the book, especially when discussing self-assessment and the selection of appropriate methods of treatment and regeneration. Summary. In this lesson, we examine depression from a biological perspective, starting with the scale of the phenomenon, moving through genetic vulnerability, neurochemistry, the effects of chronic stress and cortisol, and finally the functional changes observed in the brain. This picture is coherent and unambiguous. Depression is not a defect of the psyche nor damage to the brain, but a state of overload of the biological system that has been operating beyond its regulatory capacity for an extended period. Genetic vulnerability defines the limits of the nervous system's resilience, but it does not cause the illness on its own. The decisive factor is chronic stress, which, by keeping the stress axis in a state of continuous activation, gradually dysregulates brain neurochemistry and the functioning of the entire organism. Sleep disturbances, loss of energy, problems with concentration, and the loss of the ability to experience pleasure are therefore not psychological symptoms, but biological consequences of long-term overload. Brain research shows that in depression there are functional changes in areas responsible for emotional regulation, stress response, and the reward system. These changes, however, are neither permanent nor degenerative. The brain does not stop working, it shifts into an emergency mode, limiting energy expenditure and keeping the organism in a state of heightened vigilance. This strategy is adaptive in the short term, but in the long term it leads to exhaustion. The various forms of depression, episodic, chronic, atypical, or seasonal, do not contradict this model, they confirm it. They represent different manifestations of the same biological process, in which an overloaded nervous system loses its capacity for flexible regulation. What differentiates these forms is the manner, duration, and area of decompensation, not the nature of the disorder itself. The key conclusion of this lesson is therefore a shift in perspective. Depression is not a breakdown that must be forced back into place, but a signal that biological limits have been exceeded. Understanding this fact forms the foundation of further work, both self-assessment and therapy. Only by recognizing the biological state we are dealing with can we meaningfully speak about regulation, regeneration, and the restoration of balance. In the following lessons, we will move from describing the mechanism to analyzing its consequences and possible points of intervention, beginning with the role of chronic stress and resource depletion in everyday functioning.